When I know better, I can now do better. And my mission now is to empower other people so that they can do better. And I know that in that short period of a time, if I could reverse my prediabetes, I could definitely help other people do the same. Hello, I'm Dr. Marianne Martin, and I'm also known as Dr. Hormone Hacker. So I wanted to share a little bit about my story, and it actually starts in Vietnam. That's where I was born, and I came over to the United States when I was 4 years old. Like any other immigrant family, of course, we were so excited to integrate into American life. And what that meant for us was 2 tacos for 99 cents at Jack in the Box and a dozen Winchell's donuts. And my dad had a predilection for Sara Lee's pound cake. Those were all very fond memories, in addition to my mom being an amazing cook. And of course, she was making a lot of Asian dishes that involved noodles and rice. And let's just say I have eaten well all my life. Well, I can't say I've eaten well, and you'll see what I'm talking about. So as I was growing up, my father is a physician. Both of my older brothers also ended up being physicians. And guess what? My mom was a pharmacist. So we were a very science-oriented family. And I was actually going to be the black sheep. I wasn't going to go into the family business for a long time. But as I was growing up, I had this view that whatever my parents did, that's what I would do, because they were the ones guiding me and they knew better than me. At least that's what I thought. So I kept eating a lot of fast food and junk food. And by the time I was in college, I started not feeling great when I was overeating on, Halloween candy and, things like that. That was my first sign. But I still thought if you were a healthy weight from the outside and you exercised, there was no way you were going to get diabetes. That's what I thought. And then fast forward, I did end up going into the family business, went to medical school, and what I was taught in medical school was kind of along the same lines. Everything that I learned about diabetes was people who had the risk factors of it ran in their family, they were obese, or they were on chronic steroids. Those were the people who had diabetes. So again, I thought I was okay, no matter how many carbs and sweets I was having. As long as I was on the treadmill at 10 o'clock at night running it off, I was good. That's what I thought. And so fast forward, I start practicing as an endocrinologist. And for the first 10 years, I still had that bias. If someone came in and they were not obese and they didn't have a family history, I didn't have to worry that they were going to be diabetic. I can tell you that in my early 40s, that completely changed, because that's when my grandmother had a stroke. And this is a grandmother that I remember, she was cooking meals for us in the kitchen, she was taking walks with us. I have very fond memories of my grandmother being very active. When she had her stroke, which I later learned was related to her diabetes, she was bedridden from that day until the day she passed. That was a very, very painful reminder for me of what can happen if you don't take care of yourself. But it still didn't fully hit me. The next thing that happened, my aunt developed diabetes as well, and she ended up going on dialysis. So far I've had 2 family members, and if this was the game of chess, it would be check, check. Do you know what the checkmate was? My mom. So when my mom finally was diagnosed with diabetes, I really had to sit down for a moment. I knew deep down inside I could be next. I knew I couldn't get away with what I had been doing. I just didn't want to admit it. I really thought if I looked a certain way and if I was active enough, I could protect myself. So that day when I went to the office, I asked my nurse to prick my finger so that I could find out what my hemoglobin A1C was. And for those of you who may already know, an A1C is the 3-month average of your sugars. Anything between 5.7 to 6.5 is going to be pre-diabetes, and then usually 6.5, 6.6 and above is you've crossed over to type 2 diabetes. After she pricked my finger, it felt like my heart was going to beat out of my body, because I really did think that I knew what was gonna turn up, and that was a 5.6. Can I just tell you how many patients I have sat down and looked them in the eye and said, if you have a 5.6, that's pretty much as good as having pre-diabetes. And now I was looking at myself and telling myself that same thing. It was very hard to be in that patient seat and receiving that diagnosis. And what was even harder was looking in the mirror at my career as an endocrinologist and asking myself, I have been for decades prescribing medications for people on diabetes. Am I now ready to take that treatment plan for myself? No way. There was no way I was going to go on medication. But I didn't know any better. This is what I was taught in medical school. You have diabetes, this is the treatment for it, and if you have a side effect to that first treatment, here's a second medication to overcome that. That's what I was taught. So I had to figure out a way to do better. And that's when I went on my quest to really see, what could I do lifestyle-wise? Could I change my diet? Could I upgrade what I did with my exercise? All of these things were swirling in my mind, and the internet is dangerous. I mean, when you're surfing through the internet trying to figure out what to do, it can be incredibly overwhelming and you can't tell what's accurate information or not. That's one of the advantages that I feel I had as an endocrinologist, is that I knew how to sift through the right information and really get to the heart of the matter. And the heart of the matter is this: it didn't take that dramatic of a change to make an improvement. I definitely reduced my carbs, but I didn't cut it out. I didn't say I was never gonna have rice or noodles again. I just changed the portion and when I had it. When it came to my exercise, I focused a little bit less on cardio, a little bit more on resistance training, because I knew from the research that is going to help lower my sugars. I doubled down on my hydration. I was already very good at hydration, but I was even better and more intentional because, again, just drinking more water reduces sugars. What I really needed to work on was prioritizing my sleep. I didn't realize what an impact good quality sleep had on my sugars. And then the last thing, which was very hard, was controlling my stress. I mean, we all have stress, but how we manage it means everything to your sugars levels. So 2 months later, after making some consistent but small adjustments in my nutrition, my exercise, my sleep, my stress, 2 months later, my A1C came back at 5.2. From 5.6 to 5.2 is usually what I would see when I was starting a patient on a medication. And here I was able to turn it around. Again, when I know better, I can now do better. And my mission now is to empower other people so that they can do better. And I know that in that short period of a time, if I could reverse my prediabetes, I could definitely help other people do the same.